those questions. We're gonna read, we're gonna read through this, but again, I was gonna be asking questions on top of these questions. Let me see if I can. I would like to see. Okay, I guess not. Fine, be like that. Okay, so we start off with classic presentations, right? They say gout, intellectual disability, self-mutilating behavior. They say it's Leach-Nihan, HDPRT, X-linked recessive. Please remember your X-linked recessive diseases. Okay.
Okay.
Do you know any X-linked recessive diseases?
Skip.
Okay. What was the
Fabry.
Fabry's? Any other one?
Leishman.
Mm-hmm.
Hunter's.
Sure.
Bruton's.
Bruton's. Duchenne. What's another one? G6PD. CGD.
Yeah.
See that?
Yep.
All right. What are some buzzwords that'll make you think of X-linked recessive inheritance? They'll give you a couple of things in the vignette that say, oh, this sounds like it's X-linked recessive.
Affects males more.
Affects males, sure. What else?
Skips generations.
Yep, because it says recessive. I like that. What else?
Presentation would be perhaps early.
Well, yeah, because it's recessive.
Mm-hmm.
Which is good. Which is good. That's true. So that's a good concept. Because it's recessive, they present early, and if it's dominant, they'll present a little later in life. Which is true. That's true. But also remember maternal uncle, maternal grandfather. Yeah. That's very important. Okay, maternal uncle, maternal grandfather. Some way, somehow, they'll describe it that way. They'll say mom had a brother at one time in her life who passed away. You're like, oh, so like he would have been uncle, right? Theo, he would have been the uncle. So maternal uncle, maternal grandfather. There was something else I was thinking of. And then remember the rule of 50-50s. The rule of 50-50s with X-linked recessive diseases. Okay, the rule of 50-50s, which states 50% of the girls will become carriers. 50% of girls become carriers, but 50% of the boys become or get the disease. 50% of the boys get the disease. 50% of girls are carriers. Okay, very important to remember. Also, Leach-Nihan presents with what color crystals in the urine? They had the diaper
orange.
Crystals. Orange, because who's white? Where's white diaper crystals?
Phenylketonuria?
Not phenylketonuria, no.
White.
Yeah, white diaper. That's this one, and we said orange.
What am I saying?
Is the one that has musty odor the?
No odor. That's PKU again. Go right back to PKU, not PKU. Erotic aciduria.
Oh, erotic. Okay.
Erotic aciduria. So remember, erotic aciduria, white diaper crystals. The child has high levels of erotic acid, plus or minus ammonia, depending. But if it's only high erotic acid, then what's the enzyme that's deficient if it's just erotic aciduria? What enzyme is deficient in erotic aciduria?
And which one, sorry?
Erotic aciduria, the one I'm just asking about.
Oh, is missing the carbonyl phosphate, erotic aciduria.
Strike one. Try again. So close though. Super close, but no. Try again.
Carbonyl phosphate.
Strike two. No carbonyl phosphate.
Okay. Erotic aciduria is
just erotic aciduria. Not erotic aciduria and hyperammonia. That's a different disease. I'm saying just erotic aciduria. Not erotic acidemia, I guess you want to think of it that way.
I don't remember the enzyme.
Ooh. Do you remember that?
OTC.
Incorrect. OTC would be with hyperammonemia, and I specifically said without hyperammonemia.
It is.
There it is. Woo. Easy, right? Yeah. Very good. Very good. So yeah, UMP synthase. UMP synthase would be erotic aciduria. But if they say erotic aciduria and hyperammonia, that's OTC. OTC, is that the first or the second enzyme in the urea cycle? First or second enzyme? First plus one is?
2.
Nice. That's the second enzyme. Great job. We know math and everything. All right. Second enzyme. It's a second enzyme. Why do I need to remember that? 2 for the second enzyme. 2 because there's 2 presentations. There's erotic aciduria, 1, and hyperammonia, 2.
Mm-hmm.
See, that's how I remember that one. Second enzyme in the pathway. Okay.
Mhm.
All right, good. Since we're talking about urea cycle, hey, what's the rate limiting enzyme in the urea cycle?
Urea.
The rate limiting enzyme?
It is the carbamyl phosphate. No, or
Don't fight it.
ornithyl
Don't fight it. Go back.
carbamyl phosphate
Phosphate.
2.
-1 is
1.
nice. CPS 1.
One.
Telling you, we got a
Okay.
lot of math today. Please remember, CPS 1 is only associated with one thing, urea. CPS 2 is associated with two things,
that's-
purines and pyrimidines.
Okay.
Okay, that's how I remember that one. All right, good. That was just the first one. That's just the first one. We're not going to finish all of this today because I got a lot of questions. I'm just going with, recall, and we're about to I'm gonna make some coffee now I think about it. Okay, good. So that was that one. Let me see, X-linked recessives. So yeah, again, please focus on X-linked recessives. So next one, situs inversus, sinusitis, bronchiectasis, infertility. They say cartageners, dynein arm affecting cilia. So dynein, what type of movement is associated with dynein? Anterograde or retrograde? Very nice. Retrograde, right? Which one is the anterograde?
It is.
Kinesin. Very good. All right, cartageners, they have this, they have the bronchiectasis, sinusitis, all that. That sounds very similar to cystic fibrosis, correct?
Mm-hmm.
Nice. What's the pathophysiology in cystic fibrosis? What's their issue? What's their problem? Jesus, what's all this wind? What's the problema with cystic fibrosis?
CFTR protein defect.
Hey, professor, what does that mean?
There's
Not really sure. So if we have a defect in the
protein not allowing NaCl to transport in and out of the lung and pancreas, out of the cells.
Nice. I'll take it. Very good. Okay, so then what differentiates cystic fibrosis from cartageners? They both have the respiratory infections since early age. They can both get bronchiectasia, and they can both be infertile. So what separates the two?
One has.
Sorry.
Go ahead, Alejandra.
No, Vanessa.
I was just going to say situs inversus.
Okay, that's one. Okay, what else other than the heart?
And the sperms, they have vasa recta and the
vasa. Is it vasa recta or vasorum? Vasa
no,
vasorum.
Vasa vasorum, I think.
Vasa vasorum. Oh Lord, it's all these vasas now. No, the vasa recta is in the medulla. That's in the kidney. So yeah, vasa vasorum. Vasa vasorum. No, that's in the arteries. Oh Lord. Vas deferens. Vasa. Vas deferens. No vasas. Vas deferens. There's no. I'm like, I kept thinking vasa. I'm like,
what are you guys talking about?
Exactly. I'm like, wait a minute. No, I'm like, what's going on, brain? I gotta make this coffee. Okay, so yeah, the vas deferens is missing in cystic fibrosis. Cartageners, his guys don't swim. They swim in circles. Okay, that's the problem. All right, what else though? What else is very another complication seen in cystic fibrosis that is not seen in cartageners?
It is
fat malabsorption.
Fat malabsorption, exactly. Fat malabsorption. Due to? Why is there fat malabsorption?
Pancreas issues. Right?
Great. Why are there pancreas issues? What's the pathophysiology of the pancreatic issue?
Can't get in. Sodium can't come out. They don't follow. They get like the plugs, mucus plugs. So then
that's the buzzword. There's mucus plugs. Okay. Very good. There are mucus plugs. Why? Because the mucus is dried out. Oh, hey, boo. How's it going? I'm just here talking. So yeah, the mucus is dried out and therefore causes the plugs in the lungs, causes the plugs in the pancreas, and therefore you got to give them fat soluble vitamins, right?
Mm-hmm.
Like which ones?
Vitamin K, E, D, A.
Nice, because if you don't give them vitamin K, then what happens?
Um,
No clotting.
No clotting. With which factors? Which factors are dependent on vitamin K?
10, 9, 7, 1972 CS.
7-2. CNS. Very nice. And is it activated or inactivated vitamin K that stimulates these guys?
Vitamin K activated.
Activated. How do you activate vitamin K?
Is epoxy something, and then
Nice. Which is inhibited by which drug?
warfarin.
Nice. Which causes an increase of PT or PTT?
PT,
PT, because PTT is who?
heparin.
Which has what mechanism of action?
Inhibit XA and
Hmm.
wait,
I'm waiting.
heparin.
I know it's good. I know it's heavy. I told you to get ready. Get ready.
Antithrombin 3.
Ooh, swing and a miss. If I inhibit antithrombin 3, then I cannot inhibit thrombin formation, so therefore I get a lot of thrombi. You want to stimulate antithrombin 3 to inhibit thrombin.
Okay,
Yeah. Very good. Very good. That's just vitamin K. Okay, that's just me talking about vitamin K. So let's move on. We have blue sclera, osteogenesis imperfecta, type 1 collagen. What are the different types of collagen, por favor?
1, 2, 3, 4.
Dude.
One is skin.
That's smart. That's smart.
One is skin. 2 is the collagen and artery. 3 is arteries, and 4 is kitty no. 4 is bone basement membrane.
Basement membrane. Yeah, remember, it's not just cartilage, but connective tissue. So like aqueous humor in the eyeball and blood itself is also considered connective tissue. So please remember those. All right. This collagen can be broken down in the process of gluconeogenesis, which can be induced by which stress hormone?
Epinephrine.
Epinephrine could be one of them. Sure. What's another one?
Cortisol.
Which one? Was that it? Stress hormone. Cortisol.
Cortisol.
Yes, or cortisol. Right. All right. Good. Let's talk about epinephrine though, because I was thinking about cortisol. I said nah. I like epinephrine. I want to talk about epinephrine. Hey, what's the difference between epinephrine and norepinephrine? The NO.
Well, there's a methyl group.
Ooh, which one has a methyl group?
Epinephrine.
Epinephrine, because norepinephrine has no methyl group. Great. Hey, who puts the methyl group on epinephrine? Do you know his name?
Sam.
Sam. That's right, Samuel. Samuel.
Mm.
Yeah, Sam. Adenine, methyl, something or other. But Sam transfers methyl groups. Very nice. Very nice. Do you remember the enzyme that helps with the conversion of the norepinephrine to epinephrine by any chance? I don't even need the whole name. Just give me the acronym.
Start with P and it's long.
Starts with what? What
P?
letter? P. Excellent. It's like PNAT or PNAT or something like that. Ends with a T.
Yeah.
Starts with a P. Ends with a T. Very nice. Very nice. Okay. Good. Anything else I want to say about this here? Osteogenesis. Osteogenesis perfecta can be confused, for abuse, child abuse. Why? What'll differentiate one from the other in regards to, let's say, bone fractures?
You have broken. Oh wait, what did you ask? Yeah, so it's the bone fractures. So you're asking what's the difference?
Yep, the bone fractures in OI versus child abuse.
For OI, it would be like a crushed bone, like broken apart, and then you're gonna have like a spiral fracture for child abuse of the arm, like pulling the arm and stuff like that.
Okay, I like that. Exactly. You'll have it'll be more of like a clean break. A clean break.
Okay.
Like if you were to snap a tree in half. A clean break. That's normal bone But when it comes to osteogenesis imperfecta, they call it brittle bone. So when you snap the bone, it's like a bunch of pieces, like a little explosion of bone, and that's what you'll see. A lot of little. I think they're. I forget the name. It had a name. It had a specific name. But anyways, you'll find it. You'll see it on the X-ray. I'm like, that looks like a lot of debris, like it was an explosion or something. Okay. Okay. Nice. So yeah, that was that one. Also, since we are talking about abuse, I want you to also to be aware, be on the lookout for child doesn't look at the doctor, right? Doesn't really make eye contact. The stories don't match up, right? Here's a good one. Here's a good one that almost got me, but thank goodness I had my children, so I was able to like compare and contrast. And it says, baby had some retinal hemorrhage, a little bruised up. He was maybe 2 months. I said, okay. Mama says baby rolled off of the bed. I said, wait a minute, but he's only 2 months rolling off of the bed. I found out that my daughter rolled off of the bed when she fell off of the bed, which was around 4 or 5 months. I didn't even know she could do that. And then boom, I'm like, oh, what the hell? She was on the floor crying. I said, oh my God, I didn't even know you could do that, boo. So see, but this was like 4 or 5 months. Had it been 2 months, it would have been the damage, the trauma would have been much more detrimental to that little body. But she's 4 months. She has a big old caco, hard head, so she's all right. Yeah. But I said that doesn't match up. That doesn't make any sense. So be on the lookout for stories like that. Okay, mama's story or daddy's story don't match up. They'll say something like, I saw a recent one actually. This was more of step 2 though. Mama works 2 jobs. She's dating this guy, and she's letting the guy stay at home with taking care of her daughter while she's working. And now she comes in, with like a UTI or some STD and some other things. I was like, okay, that's abuse. Circular burns. That's another one. Circular burns. So people who smoke cigarettes, they can, fucked up, but they do it. It's unfortunate, but be on the lookout for that. That's another one. Okay. And of course, retinal hemorrhage and potential intraventricular bleed as well. Retinal hemorrhage from shaken baby syndrome. Okay, so that's how you differentiate those two. Okay, elastic skin, hypermobile joints, increased bleeding, Ehlers-Danlos type 5 and type 3, which is the vascular type. Okay, that's fine. That's a small detail. But again, we already discussed the different types of collagens. What separates Ehlers-Danlos, from from the next one. There it is, Marfan's, right? What'll separate them? Well, Marfan is, although it is collagen, it's more of a fibrillin issue. You see that? Do you know what the gene is in Marfan's that's messed up? Do you remember the name of the gene?
F.
F?
No.
How you spell fibrillin?
F-I-B.
F-I-B-R-L-N, fibrillin. So FBN, fibrillin, FBN.
FBN, okay.
FBN1, yeah, fibrillin. So yeah, fibrillin, and so when it comes to Ehlers-Danlos versus Marfan's, what do they have in common in regards to the heart? They both have a similar cardiovascular disease, and I'm saying in the heart, and I'm not talking about the aorta, specific to the heart.
Oh, mitral valve?
Mitral valve, what?
Can be a prolapse or
Excellent.
regurg, I think.
Or exactly, it's a prolapse first,
Something
and then
loose.
first it'll prolapse, then it can lead to regurg. Very nice, very nice. But now, in regards to the aorta, what issue does Marfan have that Ehlers-Danlos does not have?
They have the weak aorta. You can have the dissection or the dilation.
Wonderful. Why is there a dissection and dilation in the aorta in these patients?
Fibrillin makes up part of a layer of the aorta.
Good. What layer? We have 3 layers: inner, medial, and outer.
Medial.
Medial. M for medial. M for muscle.
Okay.
Right. And the medial is also known as media. Huh? That was quite original, right?
I'll take it.
Okay. Good. So what is the name of the pathology that attacks the media in Marfan's? Oh, that's powerful.
I'm not sure.
Aortic dissection.
Cystic medial necrosis.
Oh, right,
Rosha.
right. Okay.
Cystic.
Yes. Because what do you see? You see cysts and you see necrosis in the media. Hence,
Mhm.
cystic medial necrosis. They were not that original. They weren't really original with the name. That's delish. All right. So that was that one. Okay, cystic medial necrosis, which could therefore lead to dissection. Type A or type B dissection?
Type
A.
Type A. Type
Okay.
A. Yes,
job,
because
Allie.
A for the ascending, A for the ascending aorta is what's affected. And if you have the ascending aorta having a dissection, then what's a complication at the level of the aortic valve?
Mm,
If you have a dissection, so it's hearts, the blood should be moving this way and back.
Oh,
Record.
turbulent flow. Oh.
Say it again.
Record.
Regurg. Yeah, regurg. You see, because all the blood backs up, it's dilating and it's actually widening the aortic ring. The annulus is what they call it. The aortic ring. Okay.
Mm-hmm.
Good. Versus a type B. A type B dissection. That's descending aorta. How do you treat that?
I think it's
Say it. Say
beta
it.
blockers,
Yep.
but I
Say it.
don't.
Thank you. Yep. Very nice. Oh, am I there? Can you see me? Can you hear me?
Yes.
Okay. Camera. Okay. Something happened with the camera here. Okay. Good. Oh, good. And you're recording. Nice. Where was I? I was thinking of aortic dissection. So you said beta blocker. Excellent job. Okay. Now, Marfan. We also have Marfanoid, right? Marfanoid people. So who else looks like they have Marfans?
Start with H. Oh, I
That's
forgot.
right.
Homocystinuria.
Not hetero. There.
Mhm.
Mhm.
Homocystinuria.
That's right. Homocystinuria. And who else?
The type men to be.
Men to be. Exactly. So how to differentiate those three? If they all look the same.
So, homocystinuria, they look down and in, and
Okay,
Marfan looks up and
up.
out.
Good. Okay. So with Marfans, I'm like, hey, look at me. Look, because they're tall, right? So I'm like, hey, look at me, man. Look, you're not paying attention. Well, I'm trying to, but whereas you stop looking at me, bro. It's kind of weird. You're tripping me out. See, I kind of can't look up, man. Homocystinuria, they're gonna have trouble walking up the stairs, reading the board in class, right? That's homocystinuria. Whereas Marfan is gonna have trouble walking down the stairs or reading a book in class because he has to look down, reading the newspaper, something like that. See?
Mm-hmm.
Okay. Good. Okay. Cafe au lait, polycytic fibrous dysplasia, precocious puberty. All right. So this is McCune Albright. With McCune Albright, the first thing that comes to my mind is cafe au lait spot. That's always the first thing that comes to my mind with McCune Albright. Cafe au lait spot. And then I say, well, who else has cafe au lait spots? That's neurofibromatosis and Fanconi's anemia. Neurofibromatosis and Fanconi's anemia. They give me a guy with cafe au lait spots and a bunch of neurofibromas in the face, a little mental retardation, neurofibromatosis. They give me somebody who has some anemia with a small, fat, wide thumb. Maybe they use that big old thumb to pick their nose, and because of that, now they're bleeding from the nose. They have epistaxis. That's Fanconi's anemia. Or they give me somebody with precocious puberty and bone disease. Done. That's McCune Albright. You see how I simplified it?
Mm-hmm.
I don't like details. I'm like, that's bone disease. Polyostotic fibrous dysplasia. Sure, the bone's jacked up. Precocious puberty. Okay, so the boy becomes a man, the girl becomes a boy. Might be like that. Whatever. Okay. Let me see. Anything else we're gonna say in regards to this one? McCune Albright. I don't know. I think that's it, really. Yeah. Okay, calf pseudohypertrophy. So we go back to Duchenne. You see, they got that unique Gower sign, which is what? What is this? ¿Qué es this Gower sign?
It's when you climb up from your calf, or from bend over, climb up from your legs. Use your legs to climb up.
Exactly. You're basically climbing up your legs.
Mhm.
You're using your body to climb up your legs. Exactly. Now, we have Duchenne, muscular dystrophy, and then we have Becker's muscular dystrophy. What's the main difference between those two?
Age.
Age. Any reason why age? You know why? Must be a reason why.
One is X-linked recessive and one is
Say,
autosomal.
oh, so close. You're so close.
X-linked. I don't know what the other one is.
It's not with the X-link. It doesn't have to do with the inheritance. It's all about the mutation. It's all about the mutation. So a frame shift mutation versus nonsense, missense, etc. If you have a nonsense mutation, what happens to the protein?
Stop.
It stops. So if you're born with a bunch of proteins that weren't even fully formed, you're going to present with a disease pretty early, right? Okay. In a frame shift mutation, what happens to the protein?
It's changed. It's altered.
Altered, like something completely different. So basically, like I don't have the protein. So again, when you're born, immediately you're going to have it. You're going to present with it, such as in this case, Duchenne or any autosomal recessive disease, right? Okay. But what if it's a non-nonsense? So a missense mutation. Don't you get the same? Like you get a very similar protein with a amino acid, right? But is a protein? Does it come? Is it fully formed? Well, yes. It just looks a little different. Maybe he smells a little bit different. You sure this is cheese? I don't know. Right? Just looks a little different. See what I'm saying? Okay. All right.
So is that more like frame shift or nonsense then?
So no. For them to look a little different, smell a different, taste different, you're gonna realize later on. Wait a minute. This isn't regular cow's milk. You've been giving me soy milk this whole time. But when do you realize that? Years later on. Years later, you realize that. You see that the body recognizes. Wait a minute. This isn't right. And then they have the disease. Versus frame shift or nonsense, which you're born and immediately you present with it. Okay, that's a way to look at it. So not just Duchenne and Becker's, but what about Bruton's and CVID? Not COVID. Common variable immunodeficiency. What's the main difference there? Can you guess?
Is the gamma globulin is
That's too many words.
Mutation.
The type of mutation. Exactly. See, Becker's will present early on. I believe that's I think that's a frame shift as well. Becker's, not Becker. Bruton's. Oh, these names. Bruton's and CVID is missense. Hey, handsome man, how's it going? What's up, bud? All right, wonderful. So that was that one. Okay. Oh, they also have that unique myxoma fibrofatty mesh going on down in the leg. So be on the lookout for that. A lot of these will say fibrofatty accumulation, fat and muscle. Okay, in the calf. There's the Gower sign. We just discussed Becker's non-frame shift. Okay, that doesn't say anything really. Hey, buddy, how's it going? ¿Cómo tú estás? I love the train. Okay, let's see. So we are now at. Great, the trisomy, Patau. Patau, the P's for the Pataus. Patau has all the P's. Palate, prosencephaly, polydactyly, aplasia. I believe they have a protruding tongue. They have a protruding abdomen, omphalocele. Okay, so Pataus. Puberty. Okay. And then, of course, rocker bottom feet they could potentially have, just like Edwards, but rocker bottom feet doesn't have the P sound. So it's not that high yield for Pataus. Please know the difference between the two. Edwards, on the other hand, right, 18, microcephaly, rocker bottom feet. I really want you to know the clench hands. That's what I really want you to know, the clench hands. And on top of that, not just clench hands. It's going to be like this. I don't know if you can see me. They're going to have this index finger, the index finger kind of wrapped across as if it was my thumb, but like wrapped across. It's like it looks painful, and that's how they're gonna have it. That's their clenched fist appearance. But they'll either show it to you or they'll just mention it to you and say, all right, Clenched fists, trisomy, sure. Hey, so for these trisomies, how's alpha fetoprotein going to be?
Low.
Ooh, nice. What about beta HCG?
Low. I had this question yesterday. It was weird.
That's right. That's right. But what about in Down syndrome? What's alpha fetoprotein going to be?
It's going to be normal.
Uh,
No.
AFP in
AFP
be
is
low,
down
too?
in Downs. Exactly, it's down in all these trisomies. Yeah,
okay.
but what's beta HCG in Downs? Ooh, exactly. Why? Why is beta HCG high in Downs and low in Patel and Edwards? Bless you, boo boo. Bless you, baby. Any
I'm
ideas?
not sure.
How many patients with Patels and Edwards do you see working at the Dollar Tree or McDonald's throughout your week?
Okay.
None. How many do you see with Down syndrome working?
They're
Plenty.
there.
Meaning which ones were born and lived a life and actually lived a life. Downs, which ones are not born and don't have a life. Patel and Edwards. So if they don't have a life, there's no purpose of giving them beta HCG.
Okay.
Or vice versa. Because there is no beta HCG, they have no life. Think of it that way too. Okay, so that's good. They will ask that. They're going to ask inhibin, beta HCG, and AFP. So remember that. So since we are talking about AFP, alpha fetoprotein, when would it be high?
Oh, with neural tube defects.
Neural tube defects, right? Which are normally due to what? What can cause a neural tube defect?
A decrease in folate.
Great. Like which drug?
Metrotexato,
Great.
Imetroprim,
Good. Keep knocking them out. What's the mechanism of action of both of those drugs?
inhibit tetrahydrofolate, dehydro,
I'll take it. I'll take it. I know what you're looking for. You don't got to tell the whole thing. Dihydrofolate reductase. I got you.
yes,
I got you. I got you. All right. What's the other drug that can also inhibit that dihydrofolate reductase?
Primequine is a protozoa.
Not primaquine. Not a quin, but it's a P.
Yes, a P, and it's for
what?
For
TMP-SMX?
No, we already did that. We did MTX and TMP-SMX. No more X's.
Okay.
This is for protozoa. This is nom.
And which protozoa?
Prime.
Permethrin, are you thinking, or no?
Not permethrin. That's for a special itch in a special place.
Primetamine.
I'll take it. Pyrazinamide. I think it's pyrazinamide. I think it's what it's called, or pyrimethamine. It's one of those two. I think it's pyrimethamine. The point is, it's for toxo. Hey, handsome. It's for toxoplasmosis. Okay. Nice. Very good. Let me decrease the brightness on that. Okay. Good. So there we continue with Down syndrome. They talk about the single palmar crease, but what else do I see in Down syndrome? This guy has so many issues. Just start off with the face and go down. In his face, what do we see? Down.
The canthal fold.
The eyes.
Yeah.
What else?
Macroglossia.
Big old tongue. What about in the brain? Since we're up in the face, right? Face, head area.
You'll have earlier Down syndrome, but that's not a.
Not down. Not
I
early
mean,
Down
not
syndrome.
early Alzheimer's.
Alzheimer's. They can get early Alzheimer's. They have mental retardation. Right? Yeah. Okay. Down syndrome. Let's go down as we're with Down syndrome. Let's say at the heart.
They have the cushions. Wrong with the cushions. Because the neural crest cells, they don't.
Excellent. The endocardial cushion is defective because they have no migration of the neural crest cells. Very nice. I'm going to ask about that in a second. Let's continue moving forward. We're moving downward, rather. Down syndrome, what else is wrong with them? Let's talk about their, well, we already spoke about the hands. How about this one? What about their toes? Ooh.
There's a space between the big toe and the rest of the toes.
That's right. For some reason, not really sure why. Don't know. Shh. Yeah, thank you, buddy. Thank you.
Oh, that's sweet.
That's sweet. That's sweet. Okay, so good. That was Downs again. Oh, here's another thing. Trisomy 21. You said that they are more likely to get Alzheimer's. Why, in trisomy 21, are you more likely to get Alzheimer's?
Because the gene is on the 21st chromosome,
What's the name
and
of the
they have
gene?
3 copies.
Nice.
APP or something? I don't know.
APP, which stands for,
Amylin precursor protein,
which is going to give me what, essentially?
amyloid deposits.
Yeah. See, it's precursor protein. It's like yeah, in giant cell arteritis, what I expect to see on biopsy, giant cells. In small cell lung cancer, what I expect to see, small cells. See, she's excited. She's loving this. She's like, this is such a great review, Dad.
It is. I'm excited too.
It's good. It's good. The coffee's getting me nice. I'm saddened that I have to end it early, but I would like to do this, continue this, for a much longer period. But this is still really good, anyways. Okay, so let's see. Down syndrome. This anything else? Oh, the neurocrest. That's what I want to talk about now. So, what are the neurocrest cells?
Melanocytes, odontoblasts, tracheal,
Tracheal cartilage.
endocardial, esophageal cartilage, or something.
No, endocardial. Endocardial cushion.
Okay,
And enterochromaffin cells.
And endochromaffin cells are in the where is that?
Yeah, say it.
Adrenal.
Say what you're talk. That's all right. Let your gut talk. Let your gut talk.
Okay. And then L is laryngeal cartilage.
Laryngeal cartilage.
And then P. Something. And then all ganglia, adrenal medulla, Schwann cells, and spiral something.
Spiroseptum.
Septum.
Spiroseptum, the aortical pulmonary septum. Very, very good.
Oh,
and the P, wow, it's super windy. It's so crazy windy. So yes, the P is for the pons. The P is also for, I'm sorry, did I say pons? No, not pons. I meant pia. I misspoke. Pia matter, the pia matter. And pseudo-unipolar cells, which are basically ganglia cells. So literally, the ganglia is repeated 3 times in the mnemonic. You know which mnemonic I'm talking about, right, Alejandra? Right, Multipass?
No, but I will look for it.
Oh man, Multipass, MOTELPASS. That's it. Melanocytes, odontoblasts, tracheal cartilage, enterochromaffin cells, endocardial cushion, laryngeal cartilage, pia, pseudo-unipolar cells, all ganglia, adrenal medulla, Schwann cells, and the spiral septum. Classic. They like to ask questions where all they're going to say is, this tissue, let's say a patient comes in with a melanoma, so melanocyte. They say this tissue, this cell, has an origin similar to which of the other following, and then they're going to give you like a tooth. You say, yeah, the right tooth. Yeah, on the back. Yeah, sure, why not? Doesn't matter.
Okay.
Okay, say odontoblast. Okay, wonderful. We continue then. Now, dilated cardiomyopathy, edema, alcoholism, and malnutrition, wet beriberi. Not to be confused with dry beriberi, which presents how? How is wet versus dry different?
I think wet is cardiac, has cardiac issues.
Right. And dry does not. But what is beriberi then?
Vitamin deficiency.
Which causes
like neural symptoms. That's the dry one.
Exactly. Peripheral neuropathy. It causes neuropathy. So they give me peripheral neuropathy with cardiomyopathy. That's wet beriberi. Without it, it's dry. Beriberi, B-R-E-I. I remember they spelled it B1, like B-R-E-1 for B1, B1, beriberi, B1, B1, which is a good way of looking at it. Let's see what's the battery life on this. Okay, that's good. Go downstairs. Okay, so thiamine is needed for which 4 biochemical enzymes?
I need it for the
Go ahead, one at a time. Oh, that's so great.
It's a first.
Is it branch chain alpha ketoglutarate dehydrogenase?
Alpha ketoglutarate, uh-huh.
Branch chain something.
Branch chain, amino acid, something dehydrogenase.
And
Yep. Transketolase, because you're looking for key.
transketolase, yeah.
One
And
last one.
Allie, you got
You could just the
And probably the most important one out of all of those, by far the most important one specifically to this disease. You gave me all of them except the one that's specific to the disease.
The
Which
TLC
one?
cycle.
There we go. Pyruvate dehydrogenase.
Oh, God.
Okay.
That's the one that's very, very important to remember. They just really like that one. Pyruvate dehydrogenase. So for that reason, pyruvate cannot make it into the Krebs cycle.
Okay.
So if pyruvate can't make it into the Krebs cycle, then where is he gonna go?
Okay.
If pyruvate can't make it into the Krebs cycle, then where is he gonna go?
To the alanine and
Yep, could become alanine, sure.
or
What else?
the
Where else could he go?
it's the alanine and then lactic acid.
He could become lactic acid, right. Anywhere else?
One other one, but I don't remember.
Oxalate. Oxaloacetate. Oxaloacetate,
Okay.
I'm sorry. Oxaloacetate. Okay, good.
Okay.
Does pyruvate use NAD or NADH to become lactate?
It use NAD.
H. NAD.
H.
H. Yes. How do I remember that? Well, remember when you drink alcohol, right? What happens? You create NAD or NADH when you drink alcohol. What is a byproduct of the
NADH?
metabolism? NADH. And isn't NADH a form of energy?
Mm-hmm.
Right? Okay. So if I'm drinking and I have all this energy, then what's the purpose of turning on the Krebs cycle? I have no purpose in having it on because I already have the energy that would have came from the Krebs cycle in the first place. You see that?
Mm-hmm.
Why? Because I have all this NADH. So then pyruvate, since he's not going to go in the Krebs cycle, where's he going to go? See? Well, I have all this NADH. He's going to go tickle pyruvate and say, hey, come this way. And he becomes lactate. That's why you have lactic acidosis after drinking a lot of alcohol. See?
Okay. Mm-hmm.
Right. Good.
Wait, say that last part one more time. Sorry. You get the NADH you make from drinking, and then it can't go through?
So if you make all this NADH, where does the NADH normally come from? From the Krebs cycle. That's where the majority of it comes from. But if I already have plenty, then what's the purpose of running the Krebs cycle? So it shuts off. It shuts off. And if it shuts off, pyruvate has to make a choice. I got to go somewhere. So it goes towards lactate. And that's just because the environment allows for it, because there's a lot of NADH that will pull him that way.
Mm-hmm.
You see that? So be on the lookout for that. Okay, good. So now, thymine. He's also needed for the branch chain amino acid dehydrogenase, which is classically defective in which disease? Branch chain amino acid dehydrogenase is defective.
Maple syrup?
Maple syrup urine disease.
Yeah.
What's the pathophysiology behind that guy?
It can't break down lysine, isoleucine, valine.
Nice. Very good. And for that reason, their urine maple syrup. Yeah, exactly. I said taste. I did say taste because that's what doctors used to do.
Yummy.
So, but what if it's like, nope, not sweet at all. That was a mistake. Wrong patient.
Not worth it.
I'm like, what if you messed up, man? Oh, Jesus Christ. It's just, I heard that before. I'm like, for real? Really? That's what you used to do? For real? Okay. Nobody ever messed up? Wrong patient? Okay. Just drinking piss here? And that's why doctors used to die much earlier. So be on the lookout. Okay. So that was let's see, that was that one. Uh, let's see, the trans. Okay, here's a unique one. Transketolase. What purpose does transketolase play with all this? Because I know transketolase is needed, or needs thymine rather, but what role does he play? Transketolase.
I don't know.
Hmm.
Mm.
So
Oh, it's from
go
the glucose 6-PD and then
ahead. Here we go.
helps
Here we go. Go ahead. Say it.
go like I know I can visualize the
Good.
pathway, but I don't know how to
Good.
explain that.
Which pathway? Which pathway?
The glucose 6-PD and then
Thank
goes
you.
like this.
That's it. So, Doc, glucose 6-phosphate dehydrogenase, that pathway, the HMP shunt. What's the product of the HMP shunt? What's the end product?
The end product is 5
Mhm.
5 something.
Nice.
Five.
Ribulose 5-phosphate or something like that. R5P. Very good. So this R5P, how I have it understood, is it consists of a 7-carbon and 4-carbon sugar. Okay, there's a 7-carbon and a 4-carbon sugar that makes up this ribose 5-phosphate. Now, I don't know if you remember from organic chemistry. I don't remember much of organic chemistry, but I do remember one specific thing. They said that the body can only metabolize 6 carbon sugars. Remember that? I remember the number 6. 6 and 3. 6 and 3. Anybody remember that?
No.
There's only like 6 carbon sugars, something like that. Like I don't know, like because there's 6 carbonic or carbon, I don't know, ions or something. I don't freaking chemistry. I don't remember that stuff, but I remember the number 6. All right.
Mhm.
So the body can only metabolize 6 or 3 carbon sugars. Only the reason it's only 3 because it's half a 6. So, but for the most part, 6 carbon sugar. So that means if I have a 4 carbon and a 7 carbon sugar, I can't break it down. So what I got to do? I got to convert it into a 3 and 6 carbon. Who does that? Transketolase.
Okay.
If I don't have transketolase, I now have this 4 and 7 carbon sugar that's just kind of building up within my cells in the brain, because that's another thing I want you to know. Transketolase predominantly is seen in the brain, specifically in the Wernicke area. So that means if this transketolase cannot break down the sugar stays in the cells in the Wernicke's area. And what follows sugar?
Water.
Water, osmotic burst, cellular death, Wernicke's encephalopathy. Make sure to give them thiamine before you give glucose. You see?
Mm-hmm.
All right.
Yeah.
Good stuff. I hope that was a big,
Excellent. Yeah.
that was a good one.
Yeah,
That was a
that
big
was a good.
one. Mhm. Okay. Let's see here. There was I'm so concerned for that wind. Let's see. So those what Berry. Anything else I want to say about that guy? Berry. Thiamine B1. Okay. That's all. I'm downstairs, bud. Pellagra, diarrhea, dermatitis, dementia, niacin. Niacin is needed by NAD, NADH, correct?
Mm-hmm.
So please be on the lookout. They might ask that. They might ask how is niacin related to NAD, NADH, or that whole ratio thing. So be on the lookout for that. Niacin deficiency. So niacin deficient.
Because tryptophan cannot convert to niacin.
That is okay. That's yes, that is correct. Correct. No, you're right. You're right. You're answering my question. That's true. You are answering the question. That's one way, and then that would be known as Hartnupp's disease, right? Hartnupp's
Mhm.
disease. I'm talking about just pellagra. No amino acid issue.
Mm-mm-mm-mm.
Mm,
This one, I kind of think about you, Alejandra, with this one. There's a connection here. So it has to do.
mm,
How do you get niacin in your system? Normally,
niacin.
food.
Okay.
Yeah, food. Okay, so I remember specifically the buzzword was corn-rich diet. People who have a corn-rich diet lack niacin. And I said, corn-rich diet, like Who? I said,
Mexico.
oh yeah, Mexico. There's a lot of tacos
Latin
and
people.
the burritos, and yeah, there's a lot of corn, and then just the corn on the stick with the cheese and the other stuff on top. I mean,
Yeah.
it's heavy corn. You guys love corn, so I said, okay. So every time I think of palagra, I think of an itchy Mexican. That's it. An itchy, yeah. It's just itchy. I got diarrhea, and I'm Mexicano eating corn. That's it. And I'm like, okay, that's how I remember that one. Has nothing to do with Mexicans. Nothing to do with Mexicans at all whatsoever. But I remember the fact that they mentioned corn-rich diet. I don't remember where I got that information from, but I do remember
Uh-huh.
reading that specifically, corn-rich diet. And I said, how am I supposed to remember niacin, which is random, and corn-rich diet, which is also random? And that was it.
Mexicans.
I said, oh, Mexicans like that. I'm like, are they itchy? Like, I don't know. I don't know if they're itchy. Yeah, exactly. I was like, I don't know. Okay, sure. So that silly image is what I remember, and I never
Okay.
forgot it. I never forgot it. I'm like, okay, itchy Mexicano. It's very funny to me. Yeah.
That's
So
a good
that's that
one.
one. Right. So if they give me the same guy who's itchy, right, with the pellagra and all that and the diarrhea, but they don't mention anything about the diet. They say they have a full diet, a good diet. You say, okay, well, but they in the kidneys or in the urine rather, there's an amino aciduria. Then that's tryptophan. You see,
Okay.
then that's tryptophan. Okay. Also, since we are talking about tryptophan, what else does tryptophan make other than niacin?
Serotonin. No.
Serotonin. Serotonin. What's that disease that releases a lot of serotonin? That GI disease that releases a lot of serotonin.
Carcinoid
Carcinoid. So
syndrome.
then what do you think is a side effect of carcinoid syndrome as it relates to niacin?
Pellagra,
Exactly. Do you know why?
because they're not producing niacin.
Why?
The feedback?
Not negative feedback. They both come from tryptophan. Meaning if I'm making a lot of serotonin, I'm using up
Oh,
the tryptophan.
everything's getting converted to
That's it.
serotonin.
That's it.
Okay.
So yeah, I don't have any tryptophan for niacin. You see, so that's another way to look at that too. Very good, very good. Okay, what else is released from tryptophan? If it's serotonin, what else is released? We have serotonin and what's my wife's name?
Oh,
Melatonin.
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 Okay.
Serotonin, melatonin. So, you know.
Okay.
So that's grandma, my mother-in-law calls her Mela, Melissa.
Oh.
So melatonin, serotonin. That's tryptophan. Okay.
Mhm.
By any chance, do you guys remember what food substance contains tryptophan?
Turkey type thing.
Turkey. Yeah, turkey and milk.
Okay.
So on the day of your exam, any exam, don't drink turkey. I'm sorry, don't drink milk and eat turkey. Yeah, don't drink milk.
I wouldn't try that.
Yeah, yeah, don't do that. It's a shake. It's organic. You don't even know. It's non-GMO.
Uh,
Yo, whatever, yo. Give me the stressed out turkey. Okay. So let's see here. What else? So that was pellagra. Good. A couple of things I wanted to talk about that there. Anything else? Anything else? Oh, one last thing. In regards to the NAD, NADH, when is it known? When is it reduced versus oxidized? Which one is which? NAD, NADH. Which is reduced? Which one is oxidized?
Reduced is the, and so you give the H. So I reduced you. So NADH is reduced, right?
Excellent. And therefore NAD is oxidized. Very good. Very good. Very good. All right. Cool. Let's see. So now scurvy, right? The pirate's disease, poor wound healing, bleeding of the gums. They say perifollicular hemorrhage around the follicles, the hair follicles, and periosteal hemorrhages. You must remember those. Periosteal around the bone and around the hair follicle, not just the swollen gums. Okay, specific around the bone and around the hair follicles. Perifollicular, periosteal hemorrhage. Again, vitamin C deficiency, so we can't hydroxylate proline and lysine. great. What position are proline and lysine in the synthesis of collagen? What position are they in?
Position.
1, 2, or 3? Mhm.
And-
Missionary? 1, 2, or 3?
Um,
Hmm.
and the
Three?
2.
2 and 3. Who's 1? Mhm. Who's in the 1 position? Who's always in the 1 position? Always,
The-
always, always.
Glycine.
Glycine. Always. Why is glycine always in the 1 position? He's every third. He's always
Most
every third amino
common.
acid. He's the most common. Why is he the most common?
He's the most abundant. I don't know.
He's the most abundant. Why is he the most abundant? Because he suffers a Napoleon complex.
Because he's the
Remember
smallest.
Napoleon? Because he's the smallest and he wants to be everywhere. Napoleon complex. He's the tiniest one and he wants to be everywhere.
Chismoso.
Chismoso, right? Yeah.
Yeah.
So he's all over the place. He's always in the first position, or he's every third. He's every third position. That's him. Lysine and proline, proline and lysine, doesn't matter what order they're in. It's always going to be 2 and 3. So vitamin C, again, he'll hydroxylate those guys. Hydroxylation occurs where? In which cell organelle does it occur? This hydroxylation step.
Isolation. That is after the Golgi.
You sure?
mm,
The RER?
At the RER, before the Golgi.
okay.
Before the Golgi. Then after the Golgi, you have the tropocollagen, right? Which is the collagen that looks like it has the loose ends, kind of looks like split ends,
Yeah.
right? And what do you do with split ends? You cut them. You got to remove those split ends with plasma proteases.
Mhm.
Okay. So that's later on in the synthesis of it. Please know your collagen synthesis. It's very important that you know that. It's very, very high yield stuff.
I always get the where does it happen? Where does the hydroxylation happen? That's the question
Right.
I always get.
That's the big one. That's a big one. Okay, good. Vitamin C. What else does it do? What is it known for?
Vitamin C, gums, like all the collagen.
Hmm. What else is? What other thing does he do?
Oh, something with dopamine, right?
Ooh, nice. I wasn't even thinking that. I like how you went. Yep, something with dopamine. Elaborate, Doctora.
It is required as
Yeah,
a
it's a thing.
cofactor with BH4 in the pathway.
So it gives me. Wait, what does it give me? Dopamine or dopa or norepi or epi or?
It either gives dopa or
Hey, buddy.
dopamine, I think.
I believe it gives me dopamine. I believe it gives you
I think
dopamine.
so, yeah.
Yeah, if I'm not mistaken. Come here, baby. There's a cricket out there. Okay. Hey, boo. We're just doing the. We're just knocking things out here. But yes, so I was not thinking dopamine though, but that's good. I was actually thinking antioxidant,
Oh, okay.
which essentially is what? What is two
Free
antioxidant?
radical
Oh, free radicals. Ooh, 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 ooh. Where though?
in the
In the blood or in the GI?
in the
In regards to
GI.
vitamin C. Excellent. Vitamin C is the main antioxidant for the GI tract, which
For
is
the
why
blood, it's E.
E, exactly. So anybody who has any antioxidizing an oxidative damage disease, like let's say Alzheimer's, right? When you oxidize those tau proteins,
Uh-huh.
maybe that's why you want to give them vitamin E. It doesn't treat, but it does help prevent. See,
Okay. Yeah.
makes sense, right? Or why? How about this? What's the number one cause of free radicals in the first place?
Oxidative damage. So I don't know.
Infection.
Oh, okay. Oh,
Infection.
viruses. Right.
Viruses. You see that?
Mhm.
Okay, good. So therefore, if I know that viruses are the most common cause for oxidative for free radicals, then do you understand now why Mama always said drink your orange juice?
Mhm.
See that? Drink your OJ to get your
Mhm.
vitamin C, so you don't get any more viral disease, i.e., gripe, the common cold.
Mhm.
See that? Yeah.
Okay. Mm-hmm.
Wonderful, wonderful. Let me just quickly. Okay. I could do one more then. This is good. Let's go do one more. See, this is only the first page. Holy crap. This is good. This is good. I don't know about y'all, but I think this is solid. I'm
Yeah.
glad that
I've been.
recording
This
this
is the
stuff.
moment I've been waiting for.
Yeah. Okay. Good. This is good. This is good. I'm happy about this. I like this. Me too. I try to
I'm
train my students to
obsessed
get
with
to this
this
point.
rapid review. Like,
Yeah. This is pretty good stuff. This is good stuff.
Yeah.
Can you not? Can you not, please? Okay. Um. Let me see here. Lysine. Anything else with vitamin C? Antioxidant. One other thing. One other thing that you want to give it for. Iron.
Mhm.
Yeah, iron. Yes. What happened? I love iron. What happens when iron gets oxidized? Dumb baby.
Is converting ferric.
Ferric, and why is that a problem?
Yes, metahemoglobinemia.
Which means what? What does that
Body
mean,
can't
Doc?
use it.
The what?
Well, your body can't use it in that form.
Exactly. So the hemoglobin is non-functional, so I can't use it. It can't suck up oxygen, so they're going to be basically cyanotic.
Mm-hmm.
That's why you got to give. That's why you got to give vitamin C when you give them iron tablets.
Mm-hmm.
Okay. Kuna Matata. All right, so Kuna Matata time. Okay, so I'll leave it there. We left at, well, basically we left at scurvy, but I
Mhm.
just went on a rant here, so that was good.
Awesome.
But we still have much more to do. So I mean, like I said, this was basically the end. I still want to do one more, one more session because, um, Lorraine, she paid.